And the posterior injection point, sometimes it's hard to find the bone on the posterior area, so we can tilt the needle and also aspirate and inject. And you can see total 0.3. And now we're proceeding to inject the CK4 area. And here we're marking the base here. And we touch, and we feel the anterior border of the masseter. Then, here is the first injection point. Then we clean the skin first using the cannula. And the intruder needle, circular movement. And we are using the 25 gauge 4mm cannula to doing the injections. And we're using the pen technique. And in this area, because we have some ligaments, so the patient sometimes will feel the cracking sound, they can hear the cracking sound, and we can previously tell them, and they will feel not that nervous.
So you inform the patient. You are on the subcutaneous layer, right?
Yes, we are using the voluma and fitting the subcutaneous layer. We're putting more product on the lateral and posterior part to make a nice lifting effect. See? So that's finished the injection. 0.7. And the third area we want to inject is the JW1 area, which is the mandible angle. Then we mark it first for the lateral portion of the mandible and the lower portion of the mandible. And we tend to inject in the triangular shape to give it a nice lateral support. And we clean the skin first. And intruder needle. And using the cannula, then we're doing the fanning technique.
How you use cannula for this area instead of needle?
Because the patient wants to lift up the back. So we try to using the cannula to bending on mandibular angle area to make a lateral lifting back. So that's the reason why we choose the cannula instead of the needle injection. And the more product we put on is more on the posterior part and the lateral part, instead of the central part. Because Asian patients, they don't like. Here we finish the 0.5. Because Asian patients, they don't like their face become a little bit bigger, especially in the mandibular angle. So that's the reason why we choose the cannula to get the lateral support. And now we're keep moving to the CK3 area. Then we'll ask the patient to sitting up a little bit to do the marker. Please look up and smile. Okay. We ask the patient to smile to evaluate the dynamic change. Because when we looking on the total view, when she smiles, can feel it's already got really nice volume on here. But it's a little bit content on the middle and the medial area. So that's the reason why we're using the volume to treat the smooth area.
With that three sub area, how much volume you will put in each area, sub area?
I plan to use the 0.1 at the lateral foot and 0.2 and 0.2 on the middle area and the medial area.
Okay.
So we can give a nice support for the patient and also will make her tiredness become less obvious.
So you are on the layer 4, right?
Yes, we try to put our cannula at the layer 4 to giving a better support. And here is 0.5. And finally, we are treating the nasolabial fold. We are marking first. And we plan to treat the nasolabial fold NL1 and NL2. And using the volume. In the NL1, we're using the linear injection technique, and for NL2, we're using the linear injection, but NL1, we're using the pen. So we'll feel a little discomfort on this area. So we are going to inject 0.2 on the nasolabial fold NL2 area and bending technique on the NL1 area. Okay, so now we finish the 0.5 injection, and we clean her skin first.
You can remove the marker.
We remove the marking. And also we will do some massage after the injection, especially the CK4 area and the CK3 area. So we do the massage here and rolling in and rolling out to try to make our product disperse equally. And you can see really okay. And now we finish our treatments here.
Okay.
This is the before and after the treatment. After treatment, we can notice that we got elevated of the lateral pencil area, and we diminished the nasolabial fold here. And also, when we're looking at her face, we got really nice elevated on the mouth corner. And when we see the profile view, we got really nice jawline shape and decreasing the jawline and the double chin.
Mm-hmm. Okay,
Here is our case today.
Okay, good. Yeah. So we will see the before and after after next session, Nelson's live demonstration. So thank you, Dr. Zhang Weijing. Thank you. We will see you later. So yeah, you hear the round of applause. So we will move to Shanghai COE, Dr. Yang Xi. So yeah, please.
Good morning, Dr. Pan.
Morning.
Hi, everyone. We've seen amazing injection demo before, and welcome back to Shanghai. I'm very glad to be here to share with you the 8 points lifting up with MD codes. We have a total different patient today, so let's meet our patient firstly. Our patient is 31 years old, and she has a little bit heavy soft tissue, and when we ask for her emotional attributes, she wants to look less tired, less saggy, and less sad. So we have normally patients like her with a little bit heavy face, so we are challenging the patient to use a plus volume add-on treatment for them to lift her face up. So when we separate her face into 3 parts, we can find that her upper of the face, her forehead is in good condition, and the main problem in the middle third of the face is the tear trough and a little bit accumulation on the middle of the face. And the lower face has a slightly sagging on the soft tissues on the mandible and jawline area. And we can see her profile look. We can find that she has a little bit mandibular protrusion around the mouth. And also, all of these above problems will progressively worsen due to the gingival atrophy with age. And when we split her face and find her face a little bit asymmetry, we can find that her left-hand side has a little bit slight, severe nasolabial fold and moronate line, and a little bit widened zygomatic arch on the right side. So, according to our knowledge on MD codes injection, we know that even if we are emphasis in the same volume on both sides, we still can correct the asymmetry on our patient's both sides. So let's just check today. We could do a same volume on both sides. That can we improve her asymmetry on both sides? When she lowers her head, we can see that the soft tissue on the left side are thicker and the zygoma are relatively higher, while the soft tissue and the bone on the right side are a little bit wider than the left side, which will cause the bilateral facial asymmetry to worsen with age. And we also find that she has a deviation on the mouth, so that her nasolabial fold and moronate line are severe than the right side. Next, we observe her dynamic conditions. Firstly, when she laughs, we can find her has a strong accumulation on the mid of the face and unclear jawline, so that we may hesitate that if we inject the CK1 and CK4 area, can we let her look slimmer or do more accumulation on her both sides? So that's our challenge, which is different, totally different from the injector with the patients today in other situations. So we get the treatment plan for her. Because of her shorter face, we want to extend her mid-face on a good proportion. So I choose to use cannula to inject CK4 with Voluma 0.5 ml to change the deviation on her zygomatic bone. And we continue to use Voluma in CK4 area in 0.5 ml. And JW1 with Volux 0.5 ml. And we back to CK3 area, both deep on the bone and superficial layer with Voluma and 0.3 ml and Volift 0.5 ml. And we finally get NL1 to NL3 area to directly correct her nasolabial fold with Voluma and Volift. Then we will go back to improve her lift-off result with CK4 injection techniques with Voluma, add on 0.4 ml, so that we are use Voluma with 4 ml and Volift 2 ml and Volux 1 ml. We have 7 syringes of Juvidane in total. So let's continue the injection. Dr. Pan, do you have any problem or suggestion for us to continue our injections?
Yes, you can go ahead. You already inject half face, right?
Yes, because we have a limited time, so I've done her left-hand side before. Even if she has a asymmetry on the face, we still use same volume on the right-hand side. So let's check her marks on the face. I already done marks on her face. I want to emphasize that she has a little bit heavy lower part of the face, and even though we can see that she has a little bit unclear jawline, so when we draw the marks on the lower part of the face, which we will fanning with the JW1 areas, we cannot see the draw marks in front of the patient. That can prevent us to fanning too much on her lower of the face that could widen her mandibular bones. Yeah.
Okay.
So let's continue our injection.
Yeah, please. So clean all the face, remove all the cosmetic makeup is very important. Usually clean several times. That's very important to prevent late onset, especially inflammatory complications. Dr. Yang?
Let's get started.
Okay.
Shall we start?
Yes, please.
Well, when we meet the patient who has a heavy soft tissue, I always choose an entry point with a dynamic movement with the patient, self-big smile, 大笑, so that we can choose a proper entry point. Relax. For her to avoid the cannula fanning have an unfavorable influence on the heavy soft tissues. And always extend the soft tissue when we fan on this area.
So your left hand is lifting the tissue?
Yeah, and we get the cannula on the upper border of the zygomatic arch so that we can change a little bit the directions.
Mm-hmm. And your injection level is?
Sorry?
your depth.
We are very deep to the bone to get the zygomatic ligament. 0.5 mm for balloon. So let's just get our patients to sit up to check if she has a more symmetrical on both sides than before. Okay, let's just continue. We clean, big smile, 大笑, and choose a proper entry point. For her to fan to the lateral part of the CK4 area.
Some fibrous tissue.
Yeah, but I think sometimes it's good for the patient because that means we are I prefer we use the entry point again to a little bit widen the entry point. I always extend the soft tissue, especially for the patient with heavy soft tissue that can help us in the right layer and to help the product well distributed. Okay. 0.5 mm, finished. And we let our patient to sit up to check the results. And shall we get more symmetrical results for the patient? Yes. Okay. Let's go on. Like just I said, when we inject the mandibular area, even if we are using the fanning techniques with bullets, we still do the droplets at the anterior part of the mandible angle, so that we could not widen our patient's lower face, but just give her a lifting up result. And also, we have to protect that we are not hit the gland. Okay? 0.5? Okay. We almost finished all the lateral parts to lift up her face, then we back to the CK3 area to give her a support on the middle of the face. We clean. Let the patient lie down a little bit, and we protect her orbital ring to protect her infraorbital foramen. And we choose a good place to inject. Aspirate. 1, 2, 3, 4, 5. Gently injection for the patient. We inject 0.3 ml for her, and let's just check. And we move to the cannula techniques with the lift. Okay, our patient did not feel really hurt.
Yeah, we can see she's quite relaxed.
Yeah, still. we will ask our patient to give a big smile, that's to check we are in a proper entry point. Extend the soft tissue to find the right layer that we need to inject. Okay, we finished 0.5 ml for her to lift on the middle of the face. Then we continue to, let's check the results after the CK3 injection. We could find that after the lift up results on the lateral part of the face and the medial part of the face, we can find that her lower part on at the angle of the mouth can be changed in a slightly slimmer result after the injection. Okay, let's continue to the NL1 injection. We use our finger to feel the pulse of the facial artery and give her a nice injection. Aspirate. Sometimes when we inject, we can feel the pulse for the patient is stable. That means she is in good condition when getting injected. We inject 0.3 ml for her, dip to the bone, and we change cannula with a lift to choose an entry point. The fanning linear technique. Big smile. Left. I think she has a little bit tight skin because of the acne scars she used to have, so we meet some difficulties to get the entry.
Some fibrosis.
Yeah. You know what? Volift is really soft too. I use a fanning technique, so sometimes I should be cautioned that I'm not inject too much for my patient. Okay. So we finished.
Okay, can you let the patient sit up to sleep?
0.4 syringe. Yeah, we finish after we finish the last 0.4 ml with the CK4 injection.
Okay.
We remember we emphasize the CK4 area with almost double the dose to give her a more lift up result.
You also put the fallen most posteriorly.
Yeah, more lateral part for us to avoid the puffy appearance that our patient is really refused to achieve. Okay, we finish all the injection process for her, so that we are finished all the process on both sides for the patient. Let's just check immediately after when we give the lift-up injections for the patient, and can we give her a mirror to check her result? 我们来看一下镜子，你觉得怎么样？是不是看起来对称的很正？你跟我说一下，觉得哪个位置的改善，感觉自己比较明显？Yeah, she feels that the tail trough is well improved and nicely changed on the middle of the face. 还有吗？有没有觉得对称好？有吗？ Yeah, she feels she looks much better than before on the asymmetrical of the face. So that we will take the photo for our patient. After that, we'll come back to check the before and after treatment results with the photo.
Okay, good. Les, I have a question. One question for you. You always use the entry point when you ask the patient to do animation like smiling. So when the patient smiles, can you tell us more detail about which correct location you will choose for the entry point?
There are two reasons that why I'm using animation entry point to choose for the patient. One, because when the patient, especially with a heavy soft tissue, they have a contraction when he gives big smile or other expressions. So if we use cannula, we know that we know that the tip of the cannula is a little bit away from our entry point. So that we use the fanning technique to extend the contraction of the middle or the lower of the face. So the animation choice for the heavy face of the patient is better for them to extend the soft tissue. The second reason is that when we have an expression on our face, we can see that some of the anatomical location, just like the ligament or the artery, has been changed when we have an expression. So to ask our patient to, in an expression situation, that we can avoid some dangerous situation for the anatomical location.
So to summarize, it's for the better reposition, you choose for the most margin side to do the entry?
Yeah, for example, if we are use CK4 entry point part, we could meet the zygomatic cutaneous ligament. So when we give big smile, we can find the ligament's location. So we choose a entry point that can avoid the ligament's location. That helps us in a more smooth way to fanning or to distribute the product.
Okay, thank you, Dr. Yang Xi. So we will connect to you later to show the before and after. Thank you very much.